Hello again, everyone. Welcome back to my channel. This is Nursing Practice Made Easy. This is part 2 of the video for SPAN Practicum or SPAN Practical Exam. And this video is specifically talking to the student nurses who are sitting the RENR Practicum. All right, so the regional examination for nurses registration, and this is for all the students down in the Caribbean, in the CARICOM countries, who do the regional exam. So that is Jamaica, Barbados, Trinidad and Tobago, Dominica, Antigua, Barbuda, those over in the Cayman Islands, through Bahamas, Cuba, all of those in the in the Caribbean region. That sits the practical exam that you need to pass to meet the minimum standard of practice to pass to sit the theoretical aspect of the exam in October. All right, so this is part 2 of the video, and it is geared towards helping you to prepare for your span or span of duty, prepare for your practical nurses practical exam that is very necessary to test your skills. And it is an exam that integrates both the practical and the theoretical. In other words, both the psychomotor domain and the cognitive and the affective domain. So it tests all of that together through demonstration. All right, it's geared towards seeing how you can take the cognitive, what you know, what you did in the textbooks, and how to apply it in the management of care of the patients in every aspect. All right, so this is your channel. This is Nursing Practice Made Easy. Before you get into the video, guys, hit the subscribe button. Put in your comments, of course, like, share, and make sure that you share this, because there are so many nursing students in the Caribbean countries that need something like this so that they can get a guide. They need a place on YouTube where they can go to at least find a video, all right, that can tell them specifically about the practical, about the span of duty that they are going to do. And this is usually the time of the year. This is the month of June 2021 or 2021. All right, and this is the month of June going into July, and this is usually that time of year when that practical exam is going on. Of course, the pandemic might have pushed things back a little bit, because some schools have started from in May. All right, and then usually that goes up into July. Some schools would be having their graduation in August, and usually you definitely will have to pass that practical before that graduation, because it's usually a marker. All right, so the practicum, which is a span of duty, it allows you 3 attempts at it. All right, so if you were not successful in your first attempt, it does allow you a second attempt. So if you're not successful in your first attempt, usually you have 2 weeks of remediation. You probably have to go back to the lab at your school. One of your nursing instructors will see where you fell down on, because of course they would have had the results of the exam, and they will see the areas that you were weak in, and of course will take the time out to help you to strengthen yourself, that so you can go back for a second attempt. Now after that second attempt, if it usually runs you into probably a month or 2, and that usually sometimes throws you out of that time period that you can sit the exam in October, and sometimes we'll probably throw you over into the other year, probably January, February, and then sit the exam in April. But we don't want that, all right? And that is what these videos are. We don't want that. We want to make sure that you know what you're doing, you get the information spot on, and get yourself ready. I mean, you're at home now, you might not have as much practical hours as you want to, so you definitely need a video. You definitely need an expert nurse, one who has been an examiner himself, one who has been a student from one of the schools. Of course, I'm a graduate from Northern Caribbean University, all right, so I've been through it and I've climbed up the ladder. So who a better person to tell you about this practical exam than yours truly? All right, Patrick Mackenzie is my name, and RN. And we're going to be getting down, of course, into part 2 of this span practical. All right, so this is, of course, video number 2 on your span practical. You don't want to miss video number 1. It is up there, so go and find it on the channel and listen so that you can follow up with it and carry you all the way to the end. All right, so today on this video here, I'm talking about span and the practical and your preparation. I'm going to be talking about what it is that you're going to be doing from the time you get up in the morning. Oh yeah, from the time you get up into the morning until you actually get your patient together. All right, so this is nursing. We have to take care of the whole man. We take a holistic approach. So, as a nurse, I also have to think about your psychosocial need right here. Right now, just being practical with the nursing process with you. I have to think about your psychosocial needs, all right? So, first and foremost, sometimes people go to the bed and they can't sleep and all of that. Like was mentioned in the previous video, if you practice as though you're doing an exam each day, when you have your patients leading up to the examination, and you do that every day, timing yourself and everything, then after, when it is day for the exam, the burden will not be so much. But on the day of the exam, all right, and the day of the exam sometimes is what you don't know. So that is why I want to prepare you mentally and emotionally. So if you don't know the day of the exam, in other words, your school did not give you a heads up on the day of the exam, then you want to be going out there in this period of time when you know it's the exam season, and you want to be treating your patients and moving around and organizing yourself as if this is the day of the exam. So this is what we're going to be talking about on this video in your preparation for the practical exam for span. All right, now first, when you are getting ready to go to the hospital or the facility that you're going to be doing the exam. Now, if you know the day of the exam, and which I think is really fair that, the student does get a head up, it does take off a lot of the stress. All right, but we're going to look at both scenarios, because there's really nothing in the book that says, the school has to tell the student that this is the day of the exam. If the school gives a heads up, it's really a courtesy. It's just to take the stress off the student. However, though, let's say you know the day of your exam and the day you're going to be doing the exam. Here are some other things that you must consider, guys, before you go out there to do that exam. All right, think about the resources. If you know that the resources are limited, right, look at what you can do to make it easier for you on the day of that exam. So let's say, for example, dressing sets. All right, so this is Caribbean. Not all the Caribbean, not all the hospitals in the Caribbean are equipped in terms of having, what we call manufactured labeled material. All right, some, because of financial constraints, might not be able to afford so much, right? And some probably looking at cost effectiveness might find it easier to recycle certain things. So there are two reasons. It's financial constraint, and it could be cost effectiveness when it comes on to it's easier to recycle what can be recycled, and things like forceps and galley pots and these things that are made out of metal that can run through an autoclave machine. All right, recycling those and making a sterile set from scratch is perhaps cheaper than ordering, a dressing set that is all packaged or coming straight from a manufacturer. It might be cheaper to actually set up an autoclave system and run through. In any case, a hospital must have an autoclave system anyway. As long as there's an operating theater, an autoclave system is always going to be there. All right, so so if you know that the hospital that you're going, the resources are limited, all right, see what you can do to offset that. How so? You can secure a dressing set, All right, and I know that people around the world who will be watching this video or who's watching this video right now. All right, there's also the situation for some of the hospitals in some of the African countries as well, and even some of the deep rural hospitals in some deep rural areas of first world countries that sometimes has budget constraints or sometimes has financial constraints. So it's not only developing countries that we see this issue. It's not only developing or third world or whatever socioeconomic status they might be accorded, right? By WTO, World Trade Organization, or some of the other big organizations. All right, but it's not really about the status that they have been accorded, because, like I said earlier, it could be that it's cheaper to recycle, for example, autoclave what needs to be autoclaved, or it could be that it's just definitely financial constraint or resources are short. All right, but one of the dynamics about the nursing process and the dynamics about this exam testing the nurse is really to see how well the nurse can be innovative. That's like the highest level on the psychomotor domain, and at the same time maintain those principles and guidelines that will meet world standard just the same and not cause any harm to the patient. So if you know that your hospital has some restraints there when it comes on to resources, what you can do is, for example, a dressing set. You can secure one, right? Just store it in an area, of course, where it's not going to be contaminated, where that it cannot be used. So you can store it somewhere in the hospital. You can find a nice little hiding spot. But if you're going to hide a dressing set now, you want to make sure that no moisture can get to it, because if moisture gets to it, of course, it's no longer going to be sterile. If something tear it, it's not going to be sterile anymore, that kind of thing. So if you can find a nice little place to hide it and store it, then of course on the day you can go and pull it out. Probably you're going to need a little tray that you can put your medication on, and so so you can be presentable. Let's say you can't find a tray or so. There are little trays that are sold in in the pharmacy that you can always pick up. Sanitize those, of course. You always have to sanitize your surfaces before you put anything on them. That we'll talk about in subsequent videos when we're doing our practical demonstration. All right, and there are medication cups, disposable ones. You can get those as well. And so you can always gather certain kind of material that will help to offset that kind of anxiety if there is issues with resources. If the resources are short, these are the things that you want to think about. And this also demonstrates critical thinking, because what you're doing is not violating anything as it relates to the keeping the sterility, and as it relates to not bringing any harm to the patient and all of that. So those are the things you want to consider. So before you actually turn up to the exam, you want to think about that. All right, and then when it comes now to the day of the exam, when you get to the unit, all right, so the first thing that you want to do, and here are the things now that I'm going to point out to you that you must consider. First thing you want to do, you want to put your bag away, and then, as always, every time we step on the unit, first thing, hands are sanitized. So you put your bags away. Of course, you want to take a load off. But the next thing that you're gonna do is make sure that your hands are washed. All right. Now, as CDC guidelines, if the hands are not visibly soiled, then of course you can use a hand sanitizer. You can find that on the CDC's website under hand washing and hand sanitization. So if the hands are not visibly soiled, those can be sanitized. However, what I always say, perfect practice makes perfect. So practice washing the hands whether they are visibly soiled or not. So after you put your bags away, you wash your hands, all right? And then now you want to find the nursing supervisor on the unit who is the one that is doing the delegation of patient care. All right, so the nurse manager on the unit who is doing the delegating the patient care, or who's the one that is setting up the duty roster and giving out the duties. Find that manager. All right, be polite, introduce yourself, even if you know the manager before. If the manager comes from your district, the manager might come to your church, or all of these things. But now remember, you're exhibiting professional behavior. And so therefore now you want to greet your manager respectfully, and you want to say to the manager that I have an examination today. Make sure you get to the unit early, guys. All right. And for those who do not know the day of your practical exam, always get to the unit early. It gives you leverage. All right. So you get to the unit early and you say to the manager, I got a practical exam today for span of duty, and I must pass this, because if I don't pass it, and then it lessens my chance, and I must pass because it's a prerequisite, all right, to sit the theoretical aspect of the exam in October, and it is also part of the meeting the minimum standard of practice. All right, so so one must pass the exam. So you're going in there with that mindset. All right. So you greet your manager, you let your manager know, have an exam today, and this is the type of patient that I would love if you could assign me. All right. So you want to have patients, guys, and this is always a good way to pick your patients. You want to have patients that will allow you to write a good care plan, not one that you have to baffle about when it comes on to, okay, what the care plan is going to be. You want patients that will allow you to write a good care plan. And care plan, of course, we will talk about when we get into that video. We talk about preparing your care plan for the examiner. All right. And the nursing process, of course, will come right out in that. Don't forget to check out the videos on the nursing process. They are simply broken down. It's really nursing practice made simple. All right. So the patients that you want to have, the clients that you want to get from the manager, you want those that you can do care plan on and also demonstrate practical skills on. So practical skill demonstration, head to toe assessment, that's a given, because if you want to collect your data, all right, subjective and objective, then you must do that. All right, so that demonstrate your practical skill. But when you talk about practical skills other than your demonstration of head to toe assessment, all right, you need a patient that you are able to administer medication to. All right, you're administering medication to. So if the if the medication is to be administered through a G tube, you still need a patient that you need to administer medication to. If the medication is to be administered through an NG tube, you still need a patient. And if the medication, of course, is oral, because the patient is conscious and alert and they can swallow and they have no swallowing issues, all right, so you need patient who you want to you can administer medication to. And it's always good to find patients who there is medication to be administered in the morning. Why is that so? Because if in the morning your examiner is going to come in and you have patients to administer medication to in the morning, it helps you out when it comes on to your time management going into the afternoon. The examination that you're doing, guys, the practical exam that you're doing is really 4 hours. I mean, sometimes you might tip a little bit over 4.5, 5 hours, depending on what is reasonable. And the examiner does make that judgment. But it's really 4 hours that you're budgeting for, to get stuff done and to demonstrate your skills and to see, to show that you have met the minimum standard of practice, and you can definitely move on to sit the theoretical aspect of the exam in October. All right. So, or you're going to be sitting it in April, whichever one it is. All right. But it goes for everybody. So now you want to If you have medication in the morning, that's even better. That's good. Early medication, good, because it gives you an early start, to get this out of the way, and so that you can definitely move on. So that's good. All right. So you need your patient. You need a patient that probably has a wound. We all hope that no patient would have had a wound in hospital. As a nurse talking, oh, we all hope that there would be no wounds. Why is that so? Not because I don't like wounds, but the wound that causes discomfort and pain and disturbed body image and all of that. So I think every nurse in the world would hope the patient doesn't have a wound, but of course that's not so. And so therefore, you want to have one that you're able to demonstrate a dressing on and infection control on that one. So you want to make sure that you also get a client like that. All right. Now the reason why you want to do that now is this, because if you can't find a client on the unit that will allow you to adequately demonstrate those practical skills, those cognitive skills, all right, and demonstrate physiologic and psychosocial, the care of physiologic and psychosocial integrity, and there's nothing there to assist there to do that, the examiner is going to take you to another unit. Now that can be unsettling. It can be unsettling because you already settled down on the unit, you know where to find things and all of that. And so to move you to go to another unit, it can actually affect you, in psychosocially, and then that, of course, sometimes bring anxiety, and then anxiety can lead to something else, and you get flustered and all of that. So this is why I'm saying, these are the tips I'm giving you. Okay? We're talking about your practical exam span. All right. This is why you want to get, clients on the unit that you are, that will allow you to demonstrate those skills in terms of the application of the nursing process in all areas, the nurse-patient relationship, you demonstrating all of that, demonstrate your collaboration with the other members of the management team, demonstrating your communication skills. All of this is really what it is all about, guys. All right. So so you do that. All right, you get your patients now, and you'll say, all right, satisfied, you'll work with these two. The next thing that you want to do is to make sure that you can identify these patients. Also, if these patients do not have an armband on, make sure you put armbands on them. Verifying though that they are who they are. So, looking in the chart, asking them their name, and also it depending on the type of facility, you might need somebody else with for identification. All right, so make sure they have their armbands on there. Why do you want to put the armbands on there? Because you need your two-factor authentication, or what we call two-factor identification. All right, and using the patient's armband with their name and their date of birth on it, and along with another form of identification, is part of it. All right, so when you're looking on, say, medication label, or you're looking in the computer, or you're looking in the patient's chart, you want to verify that this is the patient that you're looking on. So if there's nothing for you to verify when the patient tell you what their name is and what their date of birth is, you're going to be in problems. So make sure you put your ID bands on your patients, guys. All right, because that's going to be part of the smooth sailing when it comes around to your patient identification. All right, you're going to want to make sure you do that. Now, putting on your ID. If there's no ID band on the unit where you are, see if you can run and find some. But ask the manager first for those ID bands. If the manager says, well, we don't have any ID bands on the unit, just grab some from another place, because sometimes they run out, and whoever the person who is stocking the thing, they didn't stock that. All right, so we're not going to sell and say, boy, so no, because sometimes it happens. So you grab some somewhere else, and you come and you make sure that you properly ID your patient. Usually the ID band has the patient's name, their date of birth, the unit that they are on. It might have their date of admission on it or so. Different agencies somewhat have a little bit of a different when it comes on to ID bands. But one thing is constant for all of them: the name and the date of birth. Right? Whatever else is added, the patient's registration number or so might also be on it. All right, but other than that, the name and the date of birth is key to be on that ID band. So make sure you put your ID bands on your patient, ID your patients. All right, and then you ID your patient, so your patient is good. You're talking about putting everything together, of course, before your examiner comes. You also want to inform the patient that, all right, you introduce yourself to your patient, of course, at all times. You always ask your patient, what is your name at all times. Remember that we don't go and say, Mr. John Brown, you are Tom, right? No, remember, we don't do that. Okay. I am Patrick Mackenzie. I'll be your registered nurse today. Can you tell me what your name is? All right, always ask direct question name. If your patient is disoriented or they're probably just waking up and a little bit groggy, they might tell you yes to the thing that you asked when indeed that it would have been a no. So always ask directly the patient's name when you introduce yourself. All right, let the patient know you have an exam to do today. Why are you letting the patient know you have an exam to do today, or you're going to be presenting their information to your examiner? It gives that, one, the patient's bill of rights is the first thing that you consider, right? The patient has the right to be informed, right? The right to autonomy, right, which is self-determination. So you'll know whether or not they want to give you permission or not. So the right to be informed. So the Patient Bill of Rights, American Nurses Association 1991 Patient Bill of Rights, right? Right to be informed, right to autonomy. So you want to inform them. It also makes for good communication, and it also makes so that you respect the patient's privacy. You're not invading their privacy without their permission either. And it gives the patient the frame of mind as to what to expect, and it benefits you also. Why? Because when they know and they understand, some of these patients that you might get, they might be nurses and they might be retired nurses, so they might know the gig. They might know the deal, and so they'll be like, all right, I know what that feels like, I'm going to be nice. So it works in your favor in many ways. But most importantly, we're talking about the patient's bill of rights. So you must inform them. All right, examination will be done today. So give them an early heads up, so that when you come to introduce them to the examiner to them, they already know. They don't look like it's the first news to them, or that they're staring out of space, or they're saying, but my Lord, you came this morning and you did so many things and you didn't say anything and stuff like that. So you want to bear that in mind. That also helps to make life easier for you in taking some of the burden off you when it comes around for that. So look around the patient environment also, and make sure that there's a clean environment when it comes on to the patients there. So all of these things, because you're already assigned the patient, so you just get going, shoot out of the gate, make sure that the IDs are on there, inform them, introduce yourself to them on all of these things before you do anything, and so you get the cooperation. Look around, clean up the environment of your patient, because you're also going to be marked on that. In other words, you don't want your examiner to come in and there is the patient has a urinary catheter or urethral catheter, and of course a drainage bag attached, and the bag is so full, and you don't want them to come and see the the drainage bag on the floor either. Or they probably might have an ileostomy or some other attachment, Jackson Pratt drainage or whatever other attachment they have. You don't want them to come and see it in a certain position. You don't want anybody to come and see a drapey drainage almost full, to backing up. Or if they have a hemovac, you don't want them to come and see that hemovac so full, right? Urethral drainage, whether it's suprapubic catheter they have or urethral catheter, the bag, you don't want them to come and see the bag overflowing, backing up. Of course, now that presents safety and security issue, and that's going to tell a bad sign on you. So make sure those things are empty. If there's a urinal in there, make sure it's empty, guys. If there's vomitus, make sure it's empty. If the garbage is overflowing, make sure all things is nice and set in your patient's environment. It does bring you marks because it is on the rubric that they're looking to see. All right, didn't she see this? Didn't he see that? Didn't he see that? That kind of thing. You don't want to turn your examiner off so early. You don't want to really give your examiner a bad impression so early. Make the examiner have a good impression, early when they come. So do that. Look around. Make sure all of this is all good and stuff like that. So all of these little things you want to get done. And these you can shoot around within a 10 minutes or so, just making sure that that is got. So if you take 10 minutes out of your time after you were assigned the patient to do all of this. If you are not able to do that right off the bat, because they are about to have the morning report, all right? And the morning report is important, all right? So let us say you're not able to run and grab those 10 minutes or so to just get all of this little thing, look around, make sure that your patient environment is good, empty this, empty that, introduce, tell the patient what's going to happen, make sure your ID band is on the patient. If it is that you're not able to do that in that little 10-minute there, and just after you got the assignment, and these are the patients that you're going to have. So if you get the assignment before the morning report, it's all good too, because you want to make sure that you are at the morning report. We talk about gathering data gathering. This is one of the the method of data gathering that the nurse use. Especially you doing an exam, a practical exam. So gathering the data now, so the morning report or the hands-off report, the S-bar, all right, that is going to be taking place now. You want to be a part of that. Why? You're going to gain valuable information, especially on the clients that you were assigned by the manager. And these two clients are the two that you will be, you're going to be doing your care on and demonstrating such care. So you want to make sure that you're at the morning report. And that's why early is good. Gives you so much leverage. And so that the morning report, you listen, all right? And you're listening for. So you get a background on the patient, give you somewhere to start, all right? Because usually a very good morning report, will give S-bar. It follows an S-bar pattern, all right? So S, of course, is the situation, as in what this is all about, all right? So you talk about the S-bar format, right, of the hands-off report. All right, usually it's going to be taken that format. All right, so now the background. So the S is situation. So you're listening. What's the situation with this patient? You want to gather that information. The B there is the background of the patient. And some nurses are very good at giving you a background. Mr. Jump and Run. He was came into the ER 2-3 days ago after being hit by a trailer. All right, he was trying to cross the street with his handcart when he was struck by a trailer. He presented to the emergency room with multiple fractures. They did this, that, neuro saw him, orthopedic saw him. And so he's followed by these two firms. He was admitted to the unit X, Y, and Z. And this is so and so and so. Background, all right? And some nurses are very good at giving you a good background. And so you listen out, right? So you're gathering the data on that hands-off report because it's going to help you in this practical exam, all right? So the background. And then the assessment. The nurse tells what the current assessment is, and also what the medical assessment might have been also, and the nurse's assessment. So you get a good picture of all of that, giving you both medical diagnosis, nursing diagnosis, current assessment as the situation presents. So the A is assessment, right? And the R is recommendation. So now in the recommendation, the nurse will be telling you what he or she needs you to follow up on. So they might say, all right, I started this or I started that, but it was not complete. So recommending that you complete that. recommending that you make an appointment for him, recommending that you call to make a report on this situation or that situation, recommendation, and will also gives you some of the recommendation of the doctor or the medical team as well. Say, all right, they're recommending that he do a repeat X-ray and a repeat CT so they can see where they go from there. So a good hands-off report does follow the SBAR format. All right, and so now that is when one is giving you a report. Now there are two types of SBAR though. So there's SBAR with just one R, and there's SBAR with two R's. Now the reason why I'm telling you about the SBAR with two R's is because the last R stands for read back, and this one is usually when we are talking to the nurse practitioner or provider, the PA, or we're talking to the healthcare provider, the doctor, whoever they are. All right, and so let's say we call to present the situation. All right, as which is what the S is, and we talk about the background of the patient and the current assessment that you have here, and they know what recommendation it is. The other R stands for read back. So when the doctor gives information, you want to read it back so that you can validate that information and you're writing it down accurately. Same thing if the pharmacy call, read back what the pharmacist says. If the lab personnel call, read back what the lab personnel says. Because all of this gives, making sure that the information is validated, it's accurate, and so that doesn't create any issue for the patient, the nurse, and the medical team. So when you are at the morning handover or the change of shift report, that's a place that you can gather information on the day of your exam right there. So you start to get a heads up and a background on these patients, right? You start to hear whether or not they have an appointment, or is it that they are going to OR. If they are going to OR, that will also help you to position yourself in terms of your organization for this particular patient. Sometimes it's good, if you were to have one not going to OR. But if you have one that is going to OR, I mean, it doesn't matter really. You still can do all that demonstration. If it is that you already have one that you can do the demonstrations on when that one is gone to OR, then, you're all good. But if the one that is going to OR is the one that you want to do that demonstration on and is going to go to OR and not return, when it comes and not return in time, all right, not return in time for your examiner to examine you, then strategic planning is best from the outset to have a different patient that that you'll be able to allow things to go smoothly. All right, so you want to make sure of that. So having received the hands-off report, change of shift report, and everything, the next thing that you're going to do is that you are going to get your patient's chart and you're going to start going through it. And in the next video, I will tell you what are the things that you're really looking for to put yourself in a good position for good time management and everything. All right, so this was video number 2, talking about span of duty for RENR, regional registration for nurses examination, or regional examination for nurses registration. All right, so this is what this video is about. All right, guys, so subscribe to the channel, subscribe to the video, subscribe, share, comment. Okay, leave a comment, of course, so we can interact, and let me know how it is. If there's something, other questions that you have, of course, it will be right there. So if you look into the description section, you will see my contact and, of course, how to reach me. But, of course, I'll be looking out for your comments. I'll be definitely responding to them. All right, so until then, look out for video number 3 to tell you what's next. We're talking about what it is that you need to be doing to set yourself up nice on this day for your practical examination. All right, and though this one is geared specifically for our Caribbean students, nursing students in different Caribbean schools of nursing, of course, it is very useful information for nurses all over, especially when it comes on to patient presentation and organizing yourself to take care of your patient, on the day when you get this assignment. All right. So until then, I'll see you in the next video, and you will get information concerning span. All right. See you guys.